This is the IO skill. We're going to be establishing an IO on a pediatric patient. Want to check my equipment, make sure I have everything I need. I have the IO needle itself. It's an 18 gauge, which is just what we need for pediatric. 15 gauge would be if we were doing an adult. I have an IV lock, I have an IV flush, and I have some alcohol prep pads for the aseptic technique that we're going to do. So what we're going to do first, we're going to locate the IO site. We're going to go distal tibula. We want to make sure we're about 2 centimeters below the growth plate, about 1 to 2 finger space. So we're going to be right about in this location here. I'm going to grab my alcohol prep pad. I'm going to clean the area using the aseptic technique. Now it's real important once you've cleaned the site that you don't touch it, because if you touch it, it is no longer clean. I'm going to get my IO. There's a plastic sheath over the IO that I'm going to go ahead and remove. I'm going to stabilize the extremity, locate my site. We're going to insert at a 90-degree angle, just kind of moving back and forth till you get the little pop. Once you get the pop, that means you're in. I'm going to remove this plastic cap here. I'm going to remove the needle, disposing directly into the sharps container. And then I'm going to grab my lock, along with my flush. I'm going to connect both to the tip of the IO. And I'm going to pull back on the plunger. What I'm looking for is some bone marrow return into the syringe. You may or may not get it. And then I'm going to go ahead and flush. I got good flow. I'm going to disconnect the flush. And that is how you establish an IO.